Cervical radicular pain is a condition that often starts with discomfort in the neck, radiating down one arm. People may experience muscle weakness, numbness, or tingling in their fingers or hands. This pain is commonly caused by a herniated disc in the neck, where the soft cushion between the bones of the spine bulges or slips out of place. The result is pressure on nearby nerves, leading to pain and other symptoms. This type of pain can develop due to normal aging or after an injury. Understanding the basics of cervical radicular pain is essential before exploring treatment options. Someone is diagnosed with cervical radicular pain due to disc herniation. The first line of treatment is usually conservative. This includes rest, pain medications, nonsteroidal anti-inflammatory drugs, physical therapy, and sometimes a cervical collar to support the neck. These approaches aim to relieve pain and improve function without surgery. However, not everyone finds relief with these methods. If symptoms persist, doctors may consider more advanced intervention. Knowing the standard starting point for treatment helps set the stage for understanding where nucleoplasty fits in. Nucleoplasty is a relatively new minimally invasive procedure developed to treat contained disc herniations. The process involves removing small portions of the disc gel-like center to relieve pressure on the nerves. It's performed as an outpatient procedure, typically using local anesthesia and guided by X-ray for accuracy. One of the main appeals of nucleoplasty is that it avoids the risks associated with traditional surgery, and so far no neurological complications have been reported. But how effective is it? That's what recent research set out to discover. Researchers wanted to know if nucleoplasty could reduce pain, improve function, and enhance quality of life for people with cervical radicular pain from disc herniation. They compared nucleoplasty to placebo, no treatment, conservative therapy, other minimally invasive interventions, and surgery. To find answers, they searched multiple medical databases and trial registers, and even contacted experts in the field. Only randomized controlled trials were included, focusing on outcomes like pain, function, recovery, and adverse events, mainly at short-term follow-up. Review included 4 studies with a total of 259 participants, all aged between 16 and 65. These individuals were treated in hospitals or clinics and followed for 3 to 12 months after their procedures. The studies compared nucleoplasty to conservative treatment, pulsed radiofrequency, and surgery. Understanding the study population helps us interpret the results and see how they might apply to real-world patients. One study with 120 participants compared nucleoplasty to conservative treatment. The evidence, though low in certainty, suggested that nucleoplasty may lead to a large reduction in pain after 3 months. However, there was little to no difference in neck-related function or quality of life between the two groups. Importantly, no harmful or unwanted events were reported in either group, and no one withdrew from the study. This suggests nucleoplasty might offer pain relief, but its impact on overall function and life quality remains unclear. Another study compared nucleoplasty with pulsed radiofrequency, a treatment that uses electrical energy to target nerves and reduce pain. This study included only 34 participants, and the evidence was very uncertain. Researchers could not confidently say whether nucleoplasty had any effect on pain, neck function, recovery, or adverse events compared to pulsed radiofrequency. The small sample size and study limitations make it difficult to draw firm conclusions from this comparison. 2 studies with a total of 105 participants compared nucleoplasty to traditional surgery, specifically discectomy. The evidence here was also of low certainty. Results showed little to no difference in neck pain, arm pain, neck function, recovery, or quality of life between the 2 treatments at short-term follow-up. There were no serious complications in either group, and no one withdrew due to adverse events. This suggests that, at least in the short term, nucleoplasty and surgery may offer similar outcomes. Across all studies, no serious unwanted or harmful effects were reported for nucleoplasty or the comparison treatments. Mild temporary side effects in the nucleoplasty group included problems with swallowing. In the pulsed radiofrequency group, some people experienced headaches and muscle stiffness. The cervical group had some temporary complications such as neck pain. Overall, the procedures appeared to be safe, but the evidence is limited by the small number of participants. Confidence in the evidence was low or very low for all outcomes. The main reasons were that the studies were small, sometimes poorly conducted, and often provided incomplete information. This means that while nucleoplasty may help reduce pain, we can't be certain about its true benefits or risks. More high-quality research is needed to draw stronger conclusions about its effectiveness and safety. Disc herniation in the neck occurs when the soft cushion between the bones of the spine bulges or slips out of place. This can pinch or irritate a nerve, causing pain that spreads from the neck into the shoulder, arm, or hand. People may also feel numbness, tingling, or weakness. Most often that happens due to normal wear and tear as we age, but injuries can also cause it. Understanding the underlying problem helps explain why treatments like nucleoplasty are considered. Nucleoplasty is performed using local anesthesia to numb the area, and X-ray guidance ensures accuracy. The doctor removes small portions of the disc's nucleus to relieve pressure on the nerves. The procedure is minimally invasive and usually done on an outpatient basis, meaning patients can go home the same day. Temporary side effects may include swallowing difficulties, headaches, or muscle stiffness, but serious complications are rare. In comparing nucleoplasty to other treatments, conservative therapy, pulsed radiofrequency, and surgery, the evidence does not show a clear advantage for nucleoplasty in terms of function, quality of life, or recovery. While it may reduce pain more than conservative treatment, the certainty of this finding is low. For all treatments, no serious complications were reported, which is reassuring for patients considering their option. Current evidence, updated to February 2025, is not strong enough to fully support the use of nucleoplasty for cervical radicular pain due to disc herniation. Researchers emphasize the need for larger, well-designed studies to provide more reliable answers. Until then, patients and doctors must weigh the potential benefits and uncertainties when considering nucleoplasty as a treatment option. Summary: nucleoplasty is a minimally invasive option for treating neck and arm pain caused by herniated discs. It may reduce pain more than conservative treatment, but its effects on function and quality of life are unclear. Compared to other treatments like pulsed radiofrequency and surgery, nucleoplasty does not show clear benefits or risks. No serious side effects were reported, but the evidence is limited and uncertain. More research is needed to guide treatment decisions with confidence.